we are going to discuss an important topic. If you get silicone and oil in your eye for retinal detachment, what will happen to it over a long period of time if it's length for a longer time? Suppose the oil is left there for 6 months or 1 year, then you are going to get emulsification of the oil. Let's see what happens to the eye in this patient. And you can see this is a patient who is being examined on a slit lamp, and you can see there's a whitish area in the top over here. This is the area in the top, and this is something which you see, and if you look closely or higher magnification, you will see small bubbles or small foamy areas over in the thing, and these are emulsified oil droplets what you see. Let's see the overall picture of this patient. You can see this patient has got a pupil which is abnormally absent superiorly, so you can say he's got a broad iridectomy superiorly, and the patient was aphakic. You can't appreciate it this time, but it just seems to have a jet black pupil and deep AC, and there is some area of elevation of the iris over here. Maybe there's been a inferior PI being done to prevent that the oil from causing a pupillary block glaucoma. But this is the oil which comes into the anterior chamber and produces a hyperoleon, which you're seeing in this patient. And this typically would produce raised intraocular pressure, because these emulsified oil droplets will go into the trabecular meshwork and produce that raised pressure. You can see the oil phase, you can see in the anterior chamber, and the reason the oil moves up because it's lighter than water and the particles travel up, and that is why you would try to do an inferior iridotomy to prevent pupillary block glaucoma. In this patient, we do not see a pupillary block glaucoma. We're trying to see the retina in this patient, so we can ascertain if this patient would qualify to have that oil removed so that he does not get a retinal detachment at the end of the procedure. You will go in and remove this hyperoleon from the anterior chamber while you remove the oil, either using a 3-port pars plana approach, or you can use an AC maintainer to remove that oil droplet. Thank you very much for watching.